Country has hit the highest COVID-19 positivity rate this year at 22%. Well, in the last 24 hours, 1,130 people tested positive out of a sample size of 5,119, pushing the total number of confirmed cases up to 122,040. 12 more deaths were also recorded in the last 24 hours, which occurred on diverse dates, pushing Kenya's total coronavirus death toll to 2,023. On a positive note, however, 754 people have recovered, and the total number of recoveries now stand at 90,376. Currently, 1,013 patients are admitted in various hospitals across the country, with the number of ICU admissions shooting up to 120. 3,003 patients remain in home-based isolation and care. And as our reporter Helen Aura now tells us, the National Emergency Response Committee says medical facilities are being stretched beyond capacity by the pandemic.
The upward trajectory of new infections is unrelenting. Today, the positivity rate has increased from an average of 17% to 22%, the highest reported this year.
Our health facilities are currently overstretched, but this does not mean that they have been overrun.
We have been able to identify some variants, but these variants have been specifically in travelers who've come into the country and exited out. And so right now, in terms of this third wave, we are noting that it is not particularly propelled by the new variants.
Among key facilities stretched by the pandemic is the Kenyatta University Teaching and Referral Hospital, where all 32 ICU beds are now fully occupied. The facility says it will expand by an extra 30 units to be able to meet the demand.
We are going to be training the personnel in this hospital as we train others so they can be at the same level. We are also going, as the governor has said, to collaborate on the referral system just so that people who have complications can come to our hospital.
The committee is also cautioning facilities that seem to be jumping protocol by vaccinating ordinary citizens, insisting that the target for the first phase is frontline workers. To this end, some 40,000 frontline workers have been vaccinated.
Vaccines are not available for everybody as yet. And I want to repeat that. I think somewhere along the line, there seems to have developed some confusion that all persons, anybody, can walk to a vaccination center to get vaccines. And I want to make it very clear, those carrying out vaccinations will have to account for every dose that they have used. And that dose that they have used must be matched against an eligible person.
But even after the jab, extra caution is still being encouraged.
The AstraZeneca vaccine, once you're injected, the immune response comes after 3 weeks, partial immune response after 3 weeks. The full protection comes after the second dose, and it also takes 3 weeks to confer you. So you are talking of 14 weeks.
Helen Aura, NTV.